Bismillahirrahmanirrahim. So today we are going to study about the tumors of salivary gland. So the tumors of salivary gland can be divided into two types of tumor, the benign and the malignant tumor. The benign tumor consists of pleomorphic adenoma, which constitutes about 50% of the tumors. The Warthin tumor, the oncocytoma, cyst adenoma, and basal cell adenoma. In the malignant tumor consists of mucoepidermoid carcinoma, acinic cell carcinoma, adenocarcinoma, adenoid cystic carcinoma, and the malignant mixed tumors. In the benign tumor, these two, the pleomorphic adenoma and the Warthin tumors, are the most important one. And in the malignant, the mucoepidermoid carcinoma is the most important one. If you remember these two, it will be more than enough. So let's jump into the next slide and study about the pleomorphic adenoma. So pleomorphic adenoma, it is pleomorphic adenoma that is also called as the mixed tumor and is the most frequently occurring benign salivary gland tumor. It is called the mixed tumor or the pleomorphic adenoma because it is composed of both stromal and epithelial tissues. So thus it is a biphasic tumor. It is a biphasic tumor because it consists both of stromal tumor and the epithelial tissue tumor. It is mostly occurs in the parotid gland, although it can also occur in the submandibular, mandibular, and the sublingual glands. And it is mostly localized to the parotid gland, about 90%, and less than 10% it extends beyond its capsule, which is a pseudocapsule, not a true capsule. It is a pseudocapsule. So this tumor, this pleomorphic adenoma, may extend into the adjacent tissue due to the pseudocapsule, and this pseudocapsule is called pseudocapsules because the capsule varies in thickness, and it also missing at some points. It mostly occurs in the women, and mostly it has a female predominance, and it mostly occurs at the age of about 20 to 40 years. Now let's talk about the recurrence of this pleomorphic adenoma, which is one of the most important point of the pleomorphic adenoma. This tissue, the pleomorphic adenoma, is difficult to remove completely because of 2 points: its proximity to the facial nerve. So the surgeons are afraid of damaging the facial nerve, and they usually don't go beyond their margins to completely remove the tumors. And the second one is due to the pseudocapsule. The some small islands of the tumor may extend into the surrounding tissues. This is due to this pseudocapsule. As I have already discussed, the small islands go into the adjacent tissues and they are very difficult, and thus the recurrence occurs after the surgery due to these small islands of tumor that are present in the adjacent tissues. So it is likely to recur after resections. Now, the pleomorphic adenoma is a benign tumor, and it is a very rare chances of transforming into malignancy. But when there is rapid growth of the pleomorphic adenoma after the surgery, then it signifies that there is malignant transformation. And when there is malignant transformation, then this pleomorphic adenoma is known as carcinoma ex pleomorphic adenoma. Now let's jump towards the morphology of the pleomorphic adenoma. So grossly they can be seen as mobile, painless, circumscribed, pseudo-encapsulated mass, which is usually present at the angle of the jaw. Mobile, painless, circumscribed, pseudo-encapsulated mass, which is usually less than 6 centimeter present at the angle of the jaw. And histologically, as we have already discussed, that this is the tumor of both stroma and the epithelial tissues. So there will be components of both the stroma tumor and the epithelial tumors. So the components of epithelial tumor are, I will change the color. Components of epithelial tumors are in the form of irregular masses of anastomosing, irregular masses or anastomosing strands of stellate or fusiform epithelial cells. This is the which may form ducts or tubules. It is the epithelial components of the tumor, and they are usually embedded in the myxoid stroma that may display fibrous cartilage-like or hyalinized areas. This myxoid stroma is the stromal component. So it has two components: the irregular masses or anastomosing strands of stellate or fusiform epithelial cells and the myxoid stroma. These are the components of the pleomorphic adenoma. So here you can see the histological pictures of the pleomorphic adenoma. Here you can see these are the epithelial cells which are arranged, epithelial or myepithelial cells, arranged in the form of masses or strands. These are the strands, and they may be in the form of ducts or tubules. And in the background here you can see the myxoid background. These are all the myxoid background. The dark pink is the dark blue is the myepithelial or epithelial components of the pleomorphic adenoma, and the pinkish is the myxoid background or the stromal components of the pleomorphic adenoma. So that's all for today. Thank you.